Hi everyone, Viola Scott, occupational therapist.
Mike, the physical therapist.
And today we're going to talk about Carpel Tunnel Syndrome. And we're going to go over 2 tips on how to relieve the symptoms, and actually 2 ways to try to see if you are having Carpel Tunnel Syndrome. So let's go ahead and talk about, what are the signs and symptoms that you may have.
Well, first let me kind of tell them what carpal tunnel is.
Let's start there, right?
Yeah, the carpal tunnel is formed by the carpal bones right at your wrist. They help form your wrist. On the top of the wrist is a ligament, and in between the ligament and the carpal bones, it forms a tunnel, which is called your carpal tunnel. And the syndrome is when you start having nerve compression of the median nerve, which runs right through that tunnel.
Mm-hmm. And also, you have 9 tendons that go through that tunnel, so it's pretty compact in there.
Yep, it's squeezed pretty tight in there.
Squeezed tight in that area,
what happens is that ligament begins to, with repetitive activities such as typing on a computer, using your mouse, other occupations such as construction workers, truck drivers, things like that, they have their wrists flex for long periods of time and have a lot of flexion going on, and it causes that ligament to thicken, and when it thickens it starts to put pressure on all of that stuff in there, the ligaments, the tendons, the nerve.
So, it just is that narrowing and that impingement in that area of the median nerve that runs in there. Then you start having the symptoms, which are tingling and numbness, tingling or numbness, pain, and then you can also have weakness in the hand as well.
Yep, once it's progressing along, you can get muscle wasting of the muscle here on your thumb. If you let it go too long, you can get permanent damage to the nerve and then therefore the muscles. So some other advanced issues are loss of fine motor skills, where you can't button a button anymore. You drop things a lot. That's a common complaint.
Yeah. And the symptoms usually start off where you feel them at nighttime.
Yeah. Right, generally, when you sleep, a lot of times your wrist gets put in the flex position, and that generally is what triggers that compression on the nerves. So you may wake up and you have the tingling, which the tingling and the numbness, it only happens in the thumb,
your index,
the middle finger,
and half of your ring finger.
The inside half of the ring finger, yes. And so that's where you're going to feel it.
And if you're feeling it in your pinky finger or the whole hand, involvement, the front and back, then that most likely is not carpal tunnel.
Yeah,
there's probably something else, that's related to those issues.
Yeah, and you want to see your doctor for testing, because it could be something coming from your neck, something coming from just generalized neuropathy and things like that. So.
And a lot of things, that make the situations worse are maybe your posture at work, your ergonomics, if you're not sitting correctly and you have more of a flex position, or your hyperextension, excessive extension there, that would only make the situation worse. And if you also a lot more rounded, and not maintaining a good posture.
Yeah, that's what you want to set your desk space or your workspace up, where you don't have to slouch, and your wrist can be in a nice neutral position.
Yeah. So let's talk about the test that you can do, a quick test, and one of them is called the Phalens test. And that test, you bring your arms up and you actually flex your wrist and get them in that complete flexion and push them together like that. You're holding, make sure your shoulders are up here, and then hold that position for 30 to 60 seconds. And then if that triggers the symptoms, so if you're starting to get numbness or tingling, or sometimes some people experience a sharp pain, that goes through. And if you get that, then you're most likely testing positive there. But then I like to add the other test in, which is the Tinnels. And with that one, you just go ahead right here at the wrist area, and you just tap, 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 tap. And you'll do that for about 30 seconds. And if that triggers the symptoms once again, that you definitely are positive then for the Carpel Tunnel Syndrome.
And I've done that one with my patients. The majority of them that test positive, it is that sharp pain because it really puts some pressure on that nerve and it'll shoot right down the middle. And you know pretty quick usually if you have that one. So.
Yeah, so just a quick one. That one, which is the Phalens, is 30 to 60 seconds. And then here, just tapping right there in that area over there.
Yeah, right there, in case you can't see on her hand.
So that's the test. And then the two tips that we have on how to relieve those symptoms, and they work really well. The first one is splinting. And you can get this type of splint. It gets the hand into a neutral position, and that's the position that you want it in, so it's not impinging and it's opening up that carpal tunnel area.
And it keeps your wrist from falling into that flexion position. That's what a lot of people tell their patients. The doctors may tell you to just wear it at night when you go to bed. We've been doing this a long time, and we found that when you get the symptoms, it's best if you can wear it 24/7 as much as you can during the day. I know there's things you can't take a shower with it, I understand, but as much as you can
I usually recommend it for about 2 weeks.
Yeah, 2 weeks like that.
And of course, when somebody has come to us at that point, they are a little bit more advanced than the initial stages maybe. So I usually say wear it at night and in the day for about 2 weeks, and then at nighttime then thereafter for another 2 weeks. But I see a pretty good relief almost instantaneously after the first night or whatever. And with a lot of my patients, they find it amazing, the relief that they get from that. This one has a thumb position where it's out, so you can pretty much perform activities with your hands. You can type, any manual dexterity type of activities you can do with this on. And it also you can use it left or right side, so it depends on whichever one. So if you have a left hand, then your thumb would come through that one, but it really keeps it in that neutral position and works very well with the relief of those symptoms.
And they're easy to find. They sell them at Walmart. Any drugstore has them, at Walgreens, CVS, whatever you have in your area. But they're relatively inexpensive and very effective.
Yes. So you use that at nighttime, and then in the day for 2 weeks, and then 2 weeks at nighttime, and then should it continue, you may want to continue using it at nighttime, until you have relief completely from the symptoms.
And that's what back to the 2 weeks all the time. People might think that's kind of difficult, but it really opens up that tunnel we were talking about, and not only the nerve that's going through, it's giving it time to calm down from the inflammation caused by the impingement, but it's also the blood vessels that run through that tunnel. It's allowing more blood flow to get to your hand to heal anything that's going on that's related to the carpal tunnel. So it's really best if you give it that full 2 weeks at the beginning all the time.
Yeah. So the second tip that we have is called nerve gliding, or sometimes they call it flossing. It's known as flossing. So in the therapy world, we call it flossing, and it's kind of like, because it's that kind of motion that you get.
Yeah, you're actually just kind of stretching out that median nerve. You put your arm out to the side about shoulder height and back a little bit. I don't know if you can tell, but it's back until you feel a slight stretch across your chest here. And then your wrist is extended completely, so like that. And then basically what you do is with your wrist, you just go forward, and when you do, move your neck over and then go back. Move your neck over, go back. Neck over, go back. And it's making that nerve move just a little bit, stretch a little bit, and relax a little bit. And any kind of scar tissue that's built up along your carpal tunnel or anywhere along the nerve, it's going to help stretch that out and give it more room to naturally move.
While you were instructing, I had my hand out there, but then I was trying to follow and I was getting all confused about what I was doing. So sometimes when you're adding that head movement, it gets a little confusing. So you can start off with just where you just
do your wrist.
Wrist. Mm-hmm. And I've seen it actually, some people actually do it that way.
And that's fine too.
That way, or this way, with flossing. But if that really confuses you, adding the head movement, you can just do that motion without the head movement. Mm-hmm. But adding that in there just adds that extra glide to it.
Mm-hmm. And do it when you start doing it, attempt it first doing it 10 times.
Yes.
As long as you don't have any negative effects of increased soreness as you're doing it. If at any time you're feeling increased pain while you're doing it, stop at that point.
Or any of the symptoms. If you're feeling any of those symptoms increase, you want to then stop that. But, you wait till the next day and you can check and see. If you don't have any increase in the symptoms, then continue with the 10 times. You don't want to overdo a nerve gliding because that can actually irritate it and then make the symptoms worse. So you don't want to go ahead and say, well, I'll do 20 or 40. That's actually not good. So don't overdo it. Just stick to your 10. And then if it's too much, you drop it down to 5. And if, the 5 is too much, even drop it less than that. It's okay to start slowly and slowly progress yourself up versus trying to just go at it and having to do the maximum at the beginning because you're not doing yourself any favors. You'll make the situation worse. And I think a lot of times, we have those overachievers, that we have patients like that we have to say, you cannot do that one extra.
You have to bring them back because they'll hurt themselves more than help
by
themselves.
Doing, So those are our 2 tips, I also want to just go over, make sure that you go see your physician. If maybe you do that test and you're like, oh, okay, I'm having those symptoms, but you need to go to your physician, have them make the diagnosis, and then go from there and perform, any further exercises they may recommend, or if they do recommend therapy, you can start with therapy. But if you're in those mild stages, these exercises and tips can help at the beginning, but always consult your physician first. And is that all we have
I think
there?
that about covers it.
Yes, and if you like our videos and enjoy our content, please share them with friends and family. And if you find it beneficial or useful, add any comments at the bottom, or if you would like to see us do a certain topic, put it in the comments and we will talk about that. Well, if we can, right?
If we can,
yeah. We know that information. But also go to our YouTube channel and subscribe down the bottom and press that notification button, and we will provide more videos as we go. So thank you for listening. Till next week.